Hello, everyone. Welcome back. We are here to talk to you guys about some health topics today. My name is Tyler. I'm one of your Caldwell County health educators. I'm joined by...
Hi, I am Bree. I'm also one of the health educators here at the Caldwell County Health Department, and we are interviewing Miss
Caitlin. I work at the Caldwell County Health Department Dental Clinic.
All right, and I hear you've got some questions for us today, Caitlin.
I do have a couple.
All righty. You want to dive in?
Yeah, you guys ready?
Absolutely.
Let's dive in. So, crazy question, but what age do you guys think that children should start getting established with a dentist?
Oh, that's a good one. I'm going to guess 2 years old.
Okay, and you?
I'm going to say... let's start at like 1.5, get them introduced.
Okay.
Maybe they're not actually like getting anything done, but like get them in there and let them like meet the dentist.
Okay, yeah. So usually it is after the eruption of their first tooth, which correlates to be by their first birthday. So very close. You guys are very close.
Okay. Nice. You did good work.
With that being said, how many teeth do you think children have?
By what age?
I would say all their baby teeth.
All
All of them come in? Mm-hmm. I'm guessing this is a trick question, and I'm going to go with 32.
32, okay. You?
I'm going to go with 28.
28. Okay. Actually, it's 20. There's
okay.
only 20
Okay.
We were
teeth.
both off.
Yes, and they actually have a name for that. Their teeth are called primary teeth.
Okay.
Yes, and we normally number them from A to T
And why is that?
because that's the first 20 letters of the alphabet.
All right.
Nice.
Yes.
There you go.
Also, how many teeth do you think adults have? Like all those teeth?
Counting wisdom teeth
Counting
or
wisdom.
post-wisdom teeth surgery?
Nope, counting wisdom teeth. We could do both.
Okay, because I was going to say, I have 32.
You have 32.
Yeah.
Okay.
You said counting wisdom teeth?
Yeah, counting wisdom teeth.
I guess that'd be 36.
36.
Yeah.
Okay. It's 32
Ha-ha!
with wisdom
Got
teeth.
it.
Oh, so you still have your wisdom teeth.
I do not.
Wow.
Wait, what?
So then you don't have 32 teeth.
Oh, wow.
Oh, wait. Oh, okay.
See, well, I have 28 because I had braces.
I have 28
So,
as well.
yeah.
No wisdom teeth. Taken out.
Okay, so then I have 28.
Yes.
Oh, well, that's my bad.
Unless you have supernumerary teeth. Some people do.
It is a thing, you know.
Anything's possible. And what are those teeth called?
Secondary teeth.
Ooh, good answer, but no. What about you?
The adult teeth?
Oh, yeah, pretty much.
Permanent?
Called, yes.
Okay.
They're called permanent teeth because,
Okay.
well, they're the teeth that we would die with. Pretty
Hopefully.
much. Yes, yes, if we keep them all. That
If you
is-
take care of them.
yes, and they're
Yes.
numbered from 1 to 32.
Okay.
That's pretty much it. There's no special thing about it.
Straightforward.
Yes. So with that being said, what do you guys think is the best way to prevent cavities?
Brushing and flossing.
Regular dental checkups.
Yes, of course, all of those. So many factors, actually. My biggest thing is all oral hygiene. Just keeping up with your oral hygiene, making sure you brush daily, twice a day, once in the morning, once at night, followed with flossing once at night. Not necessary in the morning,
Okay.
but with fluoride toothpaste.
Why is fluoride toothpaste so important? Let's talk about that.
Okay, yeah, let's get to that. So, fluoride strengthens the enamel of your teeth. That is the outside of your teeth, like that fun little, when you see an x-rays, it'll be like a little white part of your teeth. And that right there strengthens the enamel from acid attacks. That does cause cavities.
Very nice.
So, that leads me, what do you guys think cause cavities?
Well, you did just tell us acid attacks.
Yes.
So I guess it depends on what causes those acid attacks.
Yes.
I'm going to guess excessive sugar
Okay.
on the teeth.
Okay, yeah, definitely a factor.
I'm going to go with acidic things like lemons, citruses,
For
things
sure.
like that. You know, they can wear away. I do know, I've talked to a dentist about that before. They asked me if I ate very acidic foods, and I do not.
Oh, wow. Actually, there's so many factors that you can't just pinpoint one. I mean, there's high sugar intake. Definitely, if you're lots of sugar, sticky candies, poor oral hygiene is definitely probably one of the number one factors. And then last but not least, medication. That can cause things like dry mouth, which you want a really sounds weird, but like a wet mouth. You don't want it dry, which is dry makes cavities happen more rapidly. But honestly, the list could go on.
Yeah.
So many factors. Do you guys actually mind if I go and show you guys how to brush and floss properly?
Yeah, that'd be
Yeah,
perfect.
let's see.
Okay, yes. So I have
Let's make sure we're doing it right.
Yes. So this right here is my awesome replica of someone's mouth.
Wait, let's count them.
Okay,
I want
let's
to see. Yeah, 16 on the bottom.
16, 32.
Yeah, 32. Nice.
Yes. Actually, we can go over teeth if you don't want to see. These are your molars. These are your premolars. These little tiny molars.
Tilted forward so they can see.
Yes.
Okay.
There you go. There you go.
These are your canines. Both sides. They actually have one of the longest roots out of all your mouth. And then these are all called your incisors. Central and lateral incisors.
All right.
Yes. Same thing on top, pretty much. And then first things first, what you're gonna do is grab your handy dandy toothbrush. You can put water, no water, I don't know. I'm not a water girly. I just, and then you wanna put the tiniest amount of toothpaste. It does not need to be like a whole line, just like I would say maybe the size of a pea. And then you just want to make sure when you're brushing, you're getting all surfaces. You want to get inside where your tongue is at. You want to get where the biting surfaces where you chomp food, and you want to get the outside where everyone sees.
Along the gum line.
Yeah, definitely along the gum line. You definitely want to kind of push up to get rid of the plaque, because plaque is also what causes cavities. And you just want to get rid of all of that. And definitely do it once in the morning, usually whenever you wake up, and then once at night, right before bed, and try not to eat after. After, okay, you would floss, and this would be nighttime only. If you floss more, you floss more. Good for you. But I usually get the longest piece of floss. You don't have to get this long, but I like big long ones. So I normally just wrap it around my middle finger, and I use my pointer finger and my thumbs to kind of navigate it between each tooth. When you're flossing, you want to go all the way up, even through the gum line, as far up as you can get, and then slide it down in a C shape. Slide it down to get all that bacteria, plaque out in between your gum. Okay, because unfortunately, gums can't just like grow back, and leaving that bacteria in there is not safe for the gums. But yeah, that's pretty good. You can always follow up with mouthwash. I personally prefer non-alcohol mouthwash. I just feel like alcohol definitely dries out your mouth a little bit.
And it burns too much. I
A
don't like
little
it.
bit, yeah, just a little bit,
Yeah,
you know?
not pleasant.
What's your favorite mouthwash?
I have to admit, I'm bad at using mouthwash. I'm not consistent
Respect.
enough with it.
Me neither. What about you?
I like the Crest Pro Health. That's what I typically use, that Brilliance one or whatever it is.
Such a good one.
I enjoy it.
But
So I have a question for you, though. Would you say flossing first or brushing first is better?
Okay, every dentist is gonna be like floss afterwards.
Okay.
But me personally, I floss first.
Okay.
I floss my teeth, then brush, and sometimes if I'm feeling spiffy, I will floss after I brush.
Okay.
Just because,
As long as you're getting it done, right?
yeah,
Yeah.
I just like it because I feel like it's breaking up all the plaque and all the bad foods. I do tend to eat a lot of sugary things, so I feel like I get a lot of plaque by the end of the day, and
Gotcha.
I feel like it breaks it up a little bit. So
Makes it easier to get it off with the brush.
yeah, exactly.
Okay.
And then go back in to follow up after the brush definitely is good. And I just feel like when you're taking it out, then you're getting rid of the plaque, so letting the fluoride seep in between each teeth.
Getting a better clean in general.
Yeah, definitely, for
okay.
sure.
Very
There's so
nice.
many, there's no wrong, no right way, just as long as you're doing it. As long as you are actively putting that mechanical motion in, scrubbing your teeth, definitely want to use a soft bristle brush, because what do y'all think a hard bristle brush would cause to teeth?
Well, I feel like it would be hard on the gums.
Okay.
That's not necessarily the teeth, but I think that it would
Okay.
maybe
what
cause
about
some
you?
irritation there.
I have to agree, it'd probably tear up your gums a little bit. I feel like it would probably tear off some of that enamel too. It's probably going to be
Yes.
too abrasive for it.
Yes, very abrasive to
Yeah.
the enamel. Hard bristle brushes,
Do they even sell those? Is
they
that a
do.
thing?
They do.
Really?
Yes. And it's probably because everyone's mouth is different. You know, some people have this thing called calculus, which is like, it's like hardened plaque. But
Okay.
like, it's only a dentist can really get it off. So that helps get rid of it.
Okay.
Not necessarily totally eliminating calculus, but it definitely helps with that.
Okay,
All right.
nice. I did have a couple other follow-up questions.
I love that.
What would you say is the proper way to brush, like the motion, like back and forth in a circle? You kind of mentioned that, like going up or down from the gum.
Definitely would say circle, for sure. And also starting at, if you're at your top teeth, starting from the gum and brushing down to the tips of your teeth.
Okay.
Definitely brushing down that way versus brushing up and pushing it into the gum, for
Okay.
sure. Because your gum health is just important as your teeth health.
Absolutely.
Yeah, because they hold the
absolutely.
teeth in place.
Exactly.
Yeah.
Yes.
Got to keep them in place.
Yes. My next follow-up question is how to properly clean your tongue. What advice do you have for that? Because I know, some people struggle with having the white stuff on their tongue.
Yeah. That definitely, that's a huge thing. That's bacteria, full of bacteria. So definitely want to bring that brush and just kind of scrub and scrape it. Okay. I would think that would be best to do last.
Okay.
Definitely last, and that's where the mouthwash would kind of come in handy too, because it would be kind of cleaning that as well, for sure. Now the fluoride, I don't know necessarily if that's going to help the tongue part, but yeah,
Okay, that's
Very
good to know.
nice.
yes.
Yeah, but that's all the questions I wanted to ask. What about you, Tyler?
I think I've asked all mine as well. I think you've covered everything wonderfully.
Yes,
Yeah, thank you, Caitlin.
Thank you. We love teeth.
Yes.
Healthy teeth are important.
Yes.
All right. Well, thank you for joining us today, Caitlin, and telling us a little bit more about your teeth and our teeth and everyone's teeth. They're
Yes.
important. And if people have questions about dental, what services you guys offer, where can they find you?
Yeah, they can always just call the health department and ask any question. No question is a dumb question. That is what I'm there for. You can either contact my office by the phone number 828-426-8525, or I think we do have a Facebook page that you
Yes.
can always ask questions, and we would love to answer any questions.
Absolutely.
Yeah.
As of right now, we don't have a definite list of services we can do right now, just because we are temporarily without a dentist, but we are actively searching for one.
So if you know a dentist, send them our way.
Yes. All right. Well, thank you guys for tuning in, and see you next time.
Thank you all.
Thank you.